Hi, everybody. It's Jessica Stone at Stansberry Research, and I've reached Amanda Cuocci with the Health and Wealth Bulletin here for a conversation on COVID-19 and what she calls the four C's. You know, you've heard of stop the spread. These are the four C's to slow the spread. Amanda, one of the curious things that you've been and I have been talking about with the research is that scientists are studying how COVID-19 impacts and infects children. What are we learning that might really be important to the parents out there?
So the first thing to remember is that children are not catching this nearly at the rate of older Americans. In fact, people are catching it the older you get. And part of that is because as we age, our immune system weakens. But then you also think, well, children don't have strong immune systems. They're always building them. They always come home with colds, right? So it's a little bit more than that. In fact, there was actually a study that just came out that children have fewer of the receptors that the virus clings to in their nose. This is the ACE2 receptor. It's something we've talked about, I think, in previous conversations that you and I have had.
We have, but I didn't realize that it's something that has to develop as you age, it sounds like.
Yeah, and I didn't know that either. So I just learned that, children, one of the reasons they think they aren't catching it as much is because they have far fewer of these receptors developed in their nasal passages. And that's, of course, how you get it through the respiratory droplets. So that's pretty interesting. And then children are also recovering faster. It's usually only 3 to 4 days they're finding, and their symptoms are more of the gastrointestinal nature, a lot more vomiting and diarrhea, less so on the coughing and the lung issues that we're seeing in adults.
Well, let me move on to some of the other research that you've been reviewing. Obviously, we're all watching the country open up and the impact on the spread of the virus, the connection there. What are the commonalities between what we've seen in the U.S. And the way the disease is spreading? What's the root cause, essentially?
So we just wrote about this in Health and Wealth Bulletin. A lot of what we're seeing is coming from things like super spreader events. But I want to say that makes it seem like you only have to avoid really big crowded places, right?
And I think we should define what a super spreader is. I think I know, but could you define that for us?
There was a study out of the University of Hong Kong where 20% of infected people actually infected 80% of those who wound up sick. So it's this 80-20 rule, and this is actually pretty common. It's called the Pareto principle, where 20% of the cause leads to 80% of the effects. So, and what they saw was that, 20% of the initial sick people got 80% sick. 10% got the other 20% sick. But they did seem to think that a lot of it is because of behaviors, environments. And so you mentioned the 4 C's at the beginning. In Japan, they've had lower rates because they've implemented a 3C policy. So they shut down everything with closed spaces, crowded spaces, anything with big crowds, and close contact. And that's really kept their numbers low. And that's something I think we're seeing, in the US where the spikes have gone down is because people are implementing that. So the one last C, the 4th C, is also constricted airflow. This is something that Doc has talked about in his weekly COVID briefings with Matt Weinshank. The idea that you really want to be in a place where the airflow is good, you can open the windows, you have a HEPA filter. That's really important.
That's what I wanted to hone in on. How do we know, Amanda, whether we are a super spreader or we're near a super spreader, even after the fact? What tells us that?
Unfortunately, we don't know. That 20% is something that people are still studying right now. We don't know what makes someone a super spreader.
So the reason that super spreading events become preventable through the 4 C's is not because you can tell who the super spreader is, but because you can tell what allows the super spreader to really become the super spreader in that type of environment.
So those 4 C's again are closed spaces. So anything indoors, anything that's crowded, lots of crowds. In fact, that was one of the first things that people did during the shutdown is they stopped crowds. Here in Maryland, it went from, I think, 250 to 100 to 50 to 10. So definitely keep those crowds small. And close contact. And those are the 3 from Japan. And then Doc and I have added the constricted airflow.
All right, Amanda Cuocci there from Health and Wealth Bulletin. Thanks for sharing the latest research and that 4th C, constricted
Constricted airflow.
Thanks, Amanda Cuocci there from Health and Wealth Bulletin for joining us with the 4th C added to the 3 Cs from Japan, that unique insight that you've been able to offer as a result of the research you're looking at. And if you would like to see much more content just like this, please subscribe to our YouTube channel. You can also find us on Facebook, Instagram, and Twitter. That's all for now. Thanks for watching.